Okay, so there's a lot to cover, and I had a hard time kind of identifying like what is absolutely necessary because a first aid course is like 4 or 5 hours long, and I'm kind of condensing this into like 30 minutes. So if I'm like speaking too quickly or maybe not explaining something in a way that makes sense for you, you can please speak up or put in the chat or whatever. I want to make sure that y'all can walk away from this and like feel more confident in your ability to help other people if things get hairy at the protest. So yeah, so let's just jump into it, I guess. So the basics here, right? Don't become a patient. You're not going to help anybody if you yourself also need help. So that would be like, don't, if the police are like throwing tear gas or firing rubber bullets into the crowd, you probably are not going to run into that kind of stuff. Like if somebody's down on the ground and they need help, um, and you try to help them, but then you yourself get injured, now there are two people who need help. And so just don't become a patient. Um, you should protect yourself from bodily fluids. It's just kind of like good practice to assume that every bodily fluid is contaminated. It's not rude or personal, but blood or vomit or spit, like you just don't want to get any of that in your own body. So protect yourself with gloves or goggles or whatever you have. A big one is to know how to check a pulse. And for the sake of time, and since we're not together in person, I just added like a video and a link at the end for you to do that, to kind of like help familiarize yourself with that. But the two pulses that you're most likely going to be looking for in a emergency situation like this would be the carotid pulse and the radial pulse. So a carotid pulse is like the pulse in your neck here, and then a radial pulse is the pulse on your wrist here. So that's important because you're going to need to prioritize when there is a real crisis kind of situation, like maybe somebody just got hit with like a less lethal kind of bullet. You need to make sure that their heart is beating. And if it's not, then like that would be your priority. Then you would start CPR. And I have links at the end for how you can sign up for CPR classes. It's pretty cool. So I did some research, and DC offers free CPR classes. Right now it's like postponed until further notice because of coronavirus, but the link is there. So as far as prioritizing goes, you want to make sure that people are conscious and like awake. If they're not conscious, then that's the first thing you need to address. Then move to the circulation, right? So if somebody's like awake and talking to you, then you know they're conscious and their heart is beating. That's great. You just kind of knock those priorities out right there. As far as like bleeding, bones, and burns go, kind of a toss up depending on the situation. And then in the following slides, there's a little bit of each of those things. So we can kind of jump in. Okay. Dehydration, this is pretty straightforward. I think we've all probably experienced it and we've seen it. If you have been like protesting, or somebody has been protesting for like 8 hours in the sun and you're not sweating and you haven't peed, probably you're dehydrated. Dehydration is when we don't have enough fluids in our body to regulate the temperature inside our body. And if you don't assess, like kind of fix that problem, then you can run into heat stroke and heat exhaustion, which is when our body is no longer regulating the temperature. And then everything's kind of up in the air inside, and we don't want that. So when you start to notice that somebody's dehydrated or you yourself is dehydrated, move to a shady area, cool off, drink Gatorade, fruit juice, whatever you like. You probably are going to want to avoid carbonated drinks because they're going to make you feel full, and then you won't be able to drink as much as you probably should. So I think that one's pretty straightforward. Skin and face irritant. Yeah, so there's like a lot of back and forth about what the best like solution to use to wash your face with, and some people say like milk, and some people are saying vinegar. I'm like not going to carry a gallon of milk in my backpack to the protest, so I think like water would be the best way to go. So a lot of people are, so one of the like actual chemicals in tear gas is a disorienting agent. So it's like, even if you keep calm as best you can, it's really going to mess with your brain in a way that makes you freak out. And so if you can, try to stay calm and do your best to reassure other people that like the freaking out that you're experiencing is actually like by design and it will go away. It's all the pain is going to go away in like 30 or 45 minutes. So move to safety by either going upwind or uphill, move to a place where there's like less air and less people. Windy is good, windy places. And then don't touch your eyes or skin. Obviously, when you go to take off your clothes, if you have to take off your shirt or something and pull it above your head, you're probably better off just cutting that shirt off rather than pulling the shirt up over your head and then like getting more of that sweet, sweet pepper spray in your eyes. So just cut your shirt off, say goodbye to the shirt. It's sad. And then flush your eyes from like the inside out. Trying to think if I have any notes here, but it's pretty straightforward. Just you can either tilt your head to the side and like wash your face, like your eyes like this, or you can have somebody tilt their head back and then flush from like the corner, inside corner to the outside corner for like many minutes. As many minutes as you have water is the right amount of minutes to do this for. Usually, like like everything that people are saying is like 15 to 20 or 10 to 15 minutes, and that's like a whole lot of water. Do your best, right? None of this is going to be like an ideal situation, so just wash the area. So yeah, treating chemical burns. So here's some burns. I tried to find a cartoon so it would be less graphic. Chemical burn, so burns are super complex, and you probably know that like hospitals have entire burn units. Like people specialize in burns. Like burns are so complex, and it was really hard to like find some good stuff to put here because it's all so relevant. Chemical burns are like in a league of their own, and that's what pepper spray and tear gas is. And because of that, you should definitely not apply anything like a burn cream or an aloe, none of that stuff, because you don't really know what the actual chemical is in the tear gas, and sometimes it's a mixture of all of them, and they might react badly. So, for example, if you put like a Vaseline or petroleum jelly, it's actually gonna like continue. It will like feed the burn, and it will just continue to burn your skin even more, which we do not want. As far as like these first, second, and third degree burns, I kind of broke it down into like minor and major burns. So first degree burn would be a sunburn. A sunburn is literally a radiation burn. So you can prevent this obviously by using sunscreen, and like a water-based sunscreen would be pretty cool because an oil-based sunscreen is like could trap any like capsaicin or any of the chemicals in the tear gas. So water-based, if you have it, I'm pretty frugal. I'm not going to go out and buy like new sunscreen. If I have a whole bottle of sunscreen and it's oil based, like do your best, work with what you got. But yeah, so that's a first degree burn. For that, you would just use like if it's not a chemical burn, it's just a sunburn, you could use aloe or burn cream, and ibuprofen would be fine. Second degree burns are burns where it's starting to burn through the tissue and you're going to have blisters. The skin might be open, there might be wounds now. Don't pop the blisters if you see any. That's like the fastest and best way to infect them. Don't pop them. And don't put anything on broken skin. So like no creams, no ointments, like none of that stuff on a broken wound or a burn or anything like that. And then third degree burns, if somebody has a third degree burn and you can see like, you can literally like see into their body way beyond like your pay grade, and that person needs to go to the hospital right away. Something to be mindful of is that a lot of burn patients actually experience severe hypothermia because when the skin is gone, they can no longer regulate their body temperature. And so a lot of people who are like seriously burned actually get really even more sick from actual literal hypothermia. And so for that, you'd want to keep the patient warm by like wrapping them in a blanket, the cleanest, or a t-shirt or whatever you have, the cleanest and like the least fuzzy thing that you have, like nothing that's like a cotton ball that like little pieces could come off and stick. And if the skin is broken, don't don't put anything like don't cover it with anything fluffy, you know, just like leave it alone. Just cover it, get them help. This is burns are so so crazy, honestly. Just keep it clean, protect the person, get them help. So bleeding, yeah. I have my notes here on a different computer, sorry. So if somebody, so this slide is based on if somebody is bleeding more than just like a knee scrape, but maybe they like got shot with like a less lethal projectile and like now they're really bleeding. So you're gonna want to get them to safety, obviously, if it's safe for you to get to them. Don't run into like the line of fire. Do not do that. So if somebody's bleeding and it's like a bad bleed, obviously you're gonna put pressure on the wound, except for a few instances. The first is an eyeball. Don't put any pressure on an eyeball, and don't put any pressure if they've been shot with something and you suspect that something is still inside their body. Don't don't press on that area because you might like lodge the projectile further into their body. So if that's the case, then you're gonna want to like put pressure above the wound, and by above I mean like between the wound and like their heart. So like if I'm shot like here in the arm, you put pressure like on the shoulder or like, you know, below the shoulder, not on the bone, obviously, to kind of try to like slow the blood flow to that area. And you might consider putting them in the shock position, which I have this picture of here. It looks super simple, but everybody uses it. Ambulance on the ambulance and in the emergency department and like everywhere. This is the shock position. It's great. By lifting the legs like this, you're just putting like slight incline and you're making it a bit more difficult for the blood to flow to the legs. And you can keep the blood like in the torso with the vital organs and the heart and the brain, which is where it's needed the most. Like, again, this is like everything has already hit the fan and we're just kind of like triaging. If like they're bleeding out, it's like either they're going to bleed out and die or maybe like their legs get like a little bit less blood to them. And then, so tourniquets, I listed here, these are like your last resort. If you're getting to the point where like you are considering using a tourniquet, you should already have like the EMTs on the way or like you're on the way to the hospital because you can do like way more damage with a tourniquet than good. With a tourniquet, like you can expect, like you should be like mentally preparing yourself that if you need to put on a tourniquet to somebody, like they could lose that limb. And by losing the limb, like that's the better option than what is happening at that time, which sucks. But I posted a video and some links at the end for like DIY tourniquets and like best practices for tourniquets. I can't, I mean, I really hope that it doesn't get to the point where we need to be putting tourniquets on each other. But if that's the case, like it's your last resort. You're gonna try like putting pressure on the wound. Like you may have to put your knee and like kneel on the wound to stop the blood and like do that if you have to. If you are going to use a tourniquet, you should always make note of the time. Hopefully you'll have like a Sharpie or somebody around you will have a Sharpie because you're writing like the gel support numbers on your body and stuff. Write the time of the tourniquet because after 2 hours, that arm or leg is going to start to die and you need to know like when you put it on so you don't accidentally like just kill all the tissue. I know it's kind of dark and I'm sorry. Don't manipulate the area. Don't try to put the skin back where you found it, like back where it's supposed to go. Don't like don't put your fingers or anything inside the wound to look for something. Don't do that. Don't remove old bandages. So I don't really know why or if we will experience this, because considering we'd be like first responders, but the bandages are really great because they are like an extra layer of stuff that the blood has to go through to get out of the body. And so by like keeping bandages there, they're like adding like, it's like helping the blood to coagulate basically. So don't take off any old bandages. The EMTs are going to do that, and so that you don't have to do that. And then don't remove any tourniquets. If you put a tourniquet on, it's on and it stays on. If you find somebody with a tourniquet, don't take it off. What would happen is when you put a tourniquet on, you're basically like cinching off, or you're trying to cinch blood flow off to the area, and that blood is going to kind of like get backed up into the rest of the body, and there's going to be pressure here at the tourniquet. If you take that tourniquet off, all the blood is going to just like start like flowing down the arm or the leg or whatever, and it's literally going to be like, literally, cannot stress this enough, spurting, and their blood pressure is going to drop, because now all of a sudden the blood that was like in their torso is now like in their limbs, and we don't want that. So don't take any tourniquets off. Don't take any bandages off. Yeah. Are there any questions? Okay.
Oh, actually, one question.
Yeah.
Sorry, I know that wasn't like directly relating to what that slide in particular. I was just wondering on the last slide when we were talking about burns.
Yeah.
If there's like gauze or something in the area, is that, I know you said like fuzz isn't good to get in there. I know gauze can sometimes be a problem with, I don't know if that's like.
Yeah. So that's a really good question. So first and second degree closed wound burns are okay. The thing is that you have to keep the burns super sterile. It's so easy to get them infected. And so if you have one of those gauze that's like in a sealed sterile pack, that would be fine. But you might not have that. And so if it was like if I was experiencing somebody with like a serious second degree burn, maybe they like picked up like a tear gas canister or something and like their whole arm is burned, I would not cover it. If you have like, if the wound and the burn is like leaking fluid, which it will do, the gauze can get stuck to it. So some people will like in the ambulances like use like a wet gauze, but you have to wet it with like a sterile liquid. So if you have all of these things, yeah, keep it sterile and like keep it covered with like a sterile wet bandage. But if it's not sterile, then you're better off just like keeping it clean, like in the air.
Gotcha. Great. Thank you.
Ew. Okay. So trauma. Trauma is just a fancy word for damage. And I have it broken down by like 3 different types of trauma, right? So sprains and fractures. This could be somebody who's just walking and maybe they're very clumsy and they just like roll their ankle, or it could be like somebody who just got like their leg kicked by a police officer and now their leg is broken. I don't know. It could be anything. RICE is my favorite. RICE stands for rest, ice, compression, and elevation, and it's like tried and true. Everyone uses RICE. Everyone loves RICE. So rest the area. Don't put any weight on the area. If you like sprained your ankle, just rest it. Ice it to reduce the swelling, or cold water or whatever you have. Compression would be to like wrap it up in a bandage or a shirt. Not only does that like help to reduce the swelling, but like as somebody with a broken bone or like a sprain, the compression will feel nice. It's just like a nice thing to do, but it also helps medically. And then elevation, elevate the affected body part like above the heart. So like we saw in the shock position here, you elevate the legs above their heart so that way it like keeps the blood like back in their upper body. If like if your wrist is broken and you elevate it above your heart, then it's like the blood has a harder time getting here and it will reduce the swelling. Don't manipulate the bone or joint. Like, cannot stress this enough. If the bone is sticking out, like don't put it back. Don't do that. Don't. If somebody's shoulder is like sticking out, don't put it back in. So something that like I learned after I started working in the emergency departments, like after I was working on the ambulance, I moved to the emergency department, is that like the doctors and the nurses and everybody at the hospital can fix, they can fix a lot. And so but they can't fix like, if you've done too much, they can't fix it. So if you leave a broken bone broken, they can fix it. But if you put the broken bone back in the wrong spot, then that person's probably gonna have to go to surgery. And it's just gonna be a whole thing. So just don't touch it. Don't touch the bone. As far as like securing the fracture or the sprain, I have some videos at the end, which I think are really nice, but you basically want to just secure like above and below the fracture, obviously, but not on a joint. So like if my shin bone is broken, then you'd want to like tape my leg to something that is hard at the ankle, and then maybe like above the knee, above and below the fracture, but not on a joint. I've seen people like come in with like their foot, like their ankle is broken, and they wrap the foot in like a folded newspaper because it's like it like holds its shape. It's not like a crumpled newspaper; it's like a folded newspaper, and it's like kind of rigid, but like holds its shape. You can use like a blanket or a towel if you can like roll it up. You want it to be like firm but not too hard. And the worst case scenario is that you can, if it's a leg, you can like tape it to the other leg to keep it straight and to keep it in place. So that's pretty much it. And then so the video that I posted kind of shows like how to splint a leg, and the guy talked about like some of the things that he's used before. So that's sprains and fractures, concussions. If somebody's concussed, they're gonna act drunk, and that's like the easiest way to explain it. They're probably gonna be like slurring their words. They're probably gonna be very slow to respond. Like, they might be confused or like moody. Like they're just gonna like be crying. Maybe they're gonna be angry. Like it affects your mood. You may be dizzy, have a headache, ringing in the ears. A concussion, for those of you who may not know, is basically when you're driving in a car with your seatbelt on and the car slams on the brakes, you kind of like get like lurched on your seatbelt. That's what happens in your brain, and your brain kind of just like gets like hit against the inside of your skull. And so this person is going to be a little bit confused, and keep them awake and keep them talking. People who are concussed are sleepy. They're always very sleepy. Have them be awake and talking, but don't ask them like yes or no questions. You want to ask them questions that will kind of assess their memory. So you could say like, "Where are we right now?" Or like, "What's my name?" Or "What's your dad's like friend's parrot's name?" Like whatever, like easy questions that like they can just short-term memory to make sure they know where they are. And then don't give them any pain medications. A lot of pain medications are like anti-inflammatory, like ibuprofen and aspirin, and it will actually thin the blood. And if their brain is bleeding, having more blood passing through the brain is actually not going to help. So don't give them any pain medication. And I would not give them any food either because they're going to throw it up. So there's that. And then less lethal, in quotes, projectiles. This one, there's no like there's no good solution. This is all like really bad stuff. So just get them to safety, get yourself to safety, and then you would treat any bleeding or burns the same way that we just covered in the other slide. So like keeping it like, clean and protecting the area, and then look for an exit wound. So if there's no exit wound, then if they got shot with something and there's an exit wound, then that thing is like inside their body. So don't put any pressure on it, elevate it, and kind of just keep the area clean, right? Like there's not a whole lot you can do. If there is an exit wound, then congrats, you have 2 wounds now to care for, and just treat the one that's worse. Prioritizing. So a lot of this first aid stuff is just prioritizing and like deciding what is the biggest issue, and then fixing it. Because with all these issues that could come up and so many limited resources, it's really just you may just have like one time to fix one thing for this person. And then I put here to always be mindful of the next spine, and this is regardless of like what happened. If somebody has like there are like videos out of people who've been shot in the head at the base of the skull, and they fall, they hit their head, now they're unconscious. Just remember that like if somebody has a broken neck, specifically like cervical 3, 4, 5, 6, and 7, or yeah, 3, 4, 5, 6, and 7. In the cervical spine, that's here, like this part of the spine. If they're broken or fractured and they get moved in the wrong way, like that person will definitely be paralyzed from the neck down. And that's just how it is. So remember that if you need to move somebody out of the way, like if they're down and maybe you didn't see what happened, so maybe they fell and they hit their head and their neck got bent in the wrong way. If they don't need to be moved, like if like the riot has like moved on and this person is safe at that point, I definitely would strongly like advise against moving them. Just keep them safe. But if you absolutely need to get them out, be mindful that there may be a neck fracture, and if you move it, you can paralyze them. What EMTs do, and even what doctors in the emergency department do, is like one person will like literally just hold the head and stabilize the head, and then the rest of the people will get the body and move the body. And so it's tough. Just be mindful of the neck spine, basically. And I think, yes, so these are the resources. Does anyone have any questions about bleeding or trauma? Okay. So that's it. So here are the resources. I linked them here, and I can put my slides like on Slack, or I can send them to somebody to get like distributed. We have like first aid classes. The DC first aid classes are free. I think that's amazing. And how to check pulse, wound care, tourniquets, tear gas. And then here are some videos: sling, we got broken leg, and then we have a tourniquet. So you can check those out. I think we're getting close to time, and then that's it. So, any questions? Let me stop sharing my screen. Okay. Well, if no one has any questions, then I just want to say thank you all very much, and I hope that I explained something for you.